Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
SevoFlurane. SevoFlurane is the agent of choice for pediatric induction because of its smooth induction. Desflurane and SevoFlurane cannot be used for Desflurane and isoflurane cannot be used for induction, whereas SevoFlurane is the smoothest induction for pediatric patients. The second choice for induction for pediatric patients is halothane. SevoFlurane is also the agent of choice for hepatic patients because it causes minimum decrease in hepatic blood flow and there is no risk of hepatotoxicity. SevoFlurane is the agent of choice for neurosurgery because it causes minimum increase in intracranial tension. SevoFlurane is agent of choice for asthmatics because of its maximum bronchodilation. Disadvantages of SevoFlurane. SevoFlurane, when it combines with soda lime, it results in compound A. SevoFlurane can cause burns in the respiratory agent like desiccated soda lime. SevoFlurane has high fluoride content, so it is avoided in renal patients. Sevoflurane can cause convulsions. Though they are very rare, but convulsions can occur in the presence of sevoflurane only in the children, mainly in the children.
Summary. SevoFlurane. SevoFlurane is the agent of choice in pediatric induction for smoothest induction. Second agent of choice for pediatric induction is halothane. Hepatic patients are also, it is the agent of choice for hepatic patients because it causes minimum decrease in hepatic blood flow and it has no risk of hepatotoxicity. It is the agent of choice for neurosurgery because it causes minimum increase in intracranial tension. It is the agent of choice in asthmatics because of maximum bronchodilation. The disadvantages are it is used along with soda lime. It can cause compound A. It causes burns in the respiratory tract. It increases fluoride content because it has high fluoride content. It is avoided in renal patients. Convulsions can occur and convulsions are very rare and they occur only in children.
thank you and thank you for watching.